You're listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with chiropractor Dr. Dennis James of Performance Chiropractic Clinic, located in Keller, Texas. Dr. James is a nationally recognized chiropractor and member of both the American and Texas Chiropractic Associations. He is also a certified acupuncturist and fellow of the Acupuncture Society of America. Dr. James specializes in family chiropractic care, treating infants to seniors. Today we're going to talk about a very important topic, acupuncture without needles. Hello, Dr. James. How are you today?
I'm doing great. Thank you.
Well, thanks for joining me. So, what is the purpose of acupuncture?
Well, the purpose and the premise of acupuncture is to actually restore the proper energy flow throughout the body. Basically, what happens is that there's 12 main meridians throughout the body that travels the energy to the different physiological systems within the body. So, whether or not it's the nervous system, the glandular, the endocrine system, eliminative system, cardiovascular system, it's all maintained by that energy that allows it to heal over and over again. So basically we take the approach to find out, is there a spot that has too much energy, too little energy? Because if that's the case, one area is going to be kind of hyperactive as opposed to another area that's hypoactive. And when it stops to work properly because it's not getting the proper energy flow, that's where that dis-ease starts to happen, and that produces different disease processes and different conditions. And now when we can approach it from a standpoint of restoring that function back to normal, we start to see those conditions start to go the other direction.
And how can you perform acupuncture without needles?
It's actually very simple. It goes back to what we were just talking about with the meridians. Acupuncture, the name of it, actually got stuck in about the 16th century for some Portuguese sailors. It's actually a derivative of what's called meridian therapy. And the entire goal is to balance those 12 meridians through acupuncture. And what that is those needles, right? The long needle insertion or short needle insertion. But there's many different methods that you can actually do to balance those meridians and create the health back to normal. And some of those things are what's called moxibustion. There's a non-piercing needle called a teishin. You can also do acupressure or microcurrent and electrical stimulation on the points. As long as you can get the energy flow back to 100% and you can get those meridians balanced, you're going to be able to produce health for the patient.
Okay, and for a patient new to acupuncture, what is a typical session like and how does it feel?
Well, first and foremost, they're going to come in and have a consultation with me. It's very important to know exactly the history of what's been going on, kind of where their health is at that moment, start to see the patterns of what's been happening so that we can have a vision of where we're going. Once we have that, we'll do an examination because we need to determine where the energy patterns have been blocked, where they're disturbed, so that we know how to get that back to 100%. And that's a very simple process. There's some instrumental findings we can do. There's visual findings we're going to see, palpatory findings, whether we're checking the pulse or checking the tongue, different kind of unique perspectives that you can do through acupuncture. And once we're able to find out exactly where those blockages are and what we need to restore it, that's going to give us an idea of the style of treatment that we're going to do. And in our office, the needleist that we do is almost always microcurrent, which is a form of electrical stimulation, or I even like acupressure even more.
And what conditions can be improved with acupuncture?
Well, there's many. Textbooks say over about 2,000 conditions. And the reason for that is because you're not actually treating the conditions themselves, you're actually restoring health, kind of like we talked about before. And once we get that function back to 100%, the conditions go away because there's not an environment of disease anymore. So once we create that health by restoring those patterns, a lot of different things can get better. But just a couple examples would be autoimmune systems we've seen improve. We've seen sleep and insomnia get better, asthma, allergy issues that restore, a lot of nerve problems that can get better with what we do, and then digestive components, high blood pressure, things of that nature.
And lastly, is acupuncture performed on a patient in conjunction with chiropractic treatment?
Depends on the case. And I'll tell you, in my office, almost always. You have to take a look at it from two different perspectives. Number one is the energy flow of the 12 meridians. That's going to determine where we see that balance is and where the energy flow is first of all going to tell us, hey, what type of acupressure are we going to do or microcurrent, what we're going to do to balance those meridians. but we're also going to check the number one kind of nerve root component of that nerve flow, and that comes from the spinal cord. And that spinal cord exits out the spine. So we're going to take a look and say, hey, if there's the energy flow that's blocked there, we're going to have to get back to that to restore that. And China is where acupuncture was started, and then you had Japan and England. And some of the main authorities out of there has stated that the spinal adjustment alone, which has been used over there as well, is one of the most important things in restoring that internal disease process. So without it, it could be inviting failure. But from a unique standpoint, if there's no interference in the spine, there's not going to be a need for a spinal adjustment. And if there's no imbalance in the meridians, there won't be a need for the acupressure. So depending on what it is, if they have an imbalance in both, we're going to combine the two to get them better as quick as possible. Otherwise, we're only going to do what's necessary.
Well, thank you, Dr. James. We know you're extremely busy, so I just want to thank you for your time and help today.
Oh, it was a pleasure to be on with you.
And for our listeners across the country, if you are interested in speaking with the doctor, please visit www.performancechiropractic.clinic or call 817-337-3636 to schedule an appointment. On behalf of our team, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading experts.
You've been listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.